What are the benefits of being a partner in a group versus being solo and on your own? We're going to explore that today on Practice Care. I'm Carl White, principal at Market Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. The mission for both is the same, and that's to help private practice owners stay private. Not only is that what they want, but I really think that care is better when it's just you and your provider sitting at the table trying to figure out what's best for you. And nobody else is secretly whispering in your provider's ear what their own agenda is, whether it's a hospital or a health system, owners in faraway lands, whoever they might be. It's better when it's just you and your provider. And today, my guest is Dr. Camysha Wright. Dr. Wright is a partner with ENT and Allergy Associates of Florida. She holds a medical degree from the Howard University College of Medicine in Washington and also holds a Master of Public Health degree from Florida A&M University. She completed her surgery internship and residency at the University of Texas Medical Branch in Galveston. She's a member of the American Medical Association, American College of Surgeons, American Academy of Otolaryngic Allergy, and the American Academy of Otolaryngology Head and Neck Surgery. Dr. Wright successfully passed both the written and oral portions of the 2012 fellow examination held by the American Academy of Otolaryngic Allergy. She may now use the additional credentials and distinction of FAAOA. She also serves at both the local, state, and national level and is the president of the Florida Society of Otolaryngology Head and Neck Surgeons for the 2022-23 year. Thank you for taking some time, Camysha, to come on Practice Care.
Thank you for inviting me. I'm honored.
Yeah, I always like to start when I meet a practitioner in a different field. You are an ENT and allergy specialist, and I'm always just curious, what was it about ENT and allergy, as opposed to any other part of the medical world, that you were attracted to?
You might find that a lot of doctors are attracted to things that they've kind of dealt with or had when they were growing up. So for me, I didn't have a medical family. I'm kind of the first in my family who has gone into medicine. So when I went to medical school, I really kind of had a really broad opinion as far as keeping my eyes open for anything. And I loved it all. I loved pediatrics. I loved general surgery. I loved internal medicine. So it was really challenging for me to try and make a decision. Ultimately, I got to an opportunity to do an ENT rotation as a subspecialty during my general surgery rotation, and fell in love. It gives you a blend of both medicine and surgery. You can see adults and children. You can operate, or if you choose not to, you can just see patients in the clinic. So you have like the best blend of all of the different specialties for me. And the complexity of the head and neck was enough to keep it from being boring. So I felt like it was just like the best fit.
Yes. Yeah, I thought you were going to say, because you're right. I mean, particularly more like on the holistic side of the world. Why'd you become a chiropractor? Well, I was in this horrific car accident and they told me I needed surgery, and then I found a chiro, and oh my God, it was life-changing. So yeah, it's true. When you say it that way, there's usually some sort of personal tie, in history that takes you. But for you, it's the variety, which is, I hadn't thought about it that way before you described it that way. That's neat. So you are in a very large partnership. You are a partner in a very large practice, rather. So,
Yes.
and so, the topic of our episode is getting big while staying private. So give us the background on it. Tell us more about it, how you found it, give us the story.
Sure. So ENT and Allergy Associates of Florida, it's I believe at this point, one of the largest single specialty groups for otolaryngology in the nation. We have over 80 doctors in the entire group. And typically the way it's structured is that we're a single group, but we have a care center model, so that each doctor's office is an individual independent care center. We are all like equal partners, but we kind of have our own care centers where we can basically, provide care to our individual patients.
Okay.
So that really attracted me because, they allow you to have this autonomy within your own practice, but then we're still operating within the group so that we can, discuss, things and have a real impact when it comes to things like negotiating with insurance companies and things like that.
Right. So you have figured out, it's really interesting. So you have figured out how to get buying power. You get big, which is so necessary, not just in healthcare, but in a lot of areas, but especially in healthcare. I mean, everything from, insurance rates to, gloves for when you're
Yes.
treating patients in the office. So larger is better
Yes.
when it comes to buying stuff. But
Mhm.
you've also found the way to maintain independence. So as a practicing clinician, do you have complete autonomy to treat patient X however you will? Is that right?
Well, we have autonomy to treat the patients as we will. Now, obviously, if you're going to do something egregious, there we do have a board and we do have oversight, and there are different compliance programs to make sure that we are practicing within the standard of care.
Sure.
So you can't just go and decide I want to do like brain surgery and I'm an ENT doctor.
Attack those allergies a different way.
Yeah, it's a totally different way. But with that being said, they give you a lot of leeway to kind of just manage your practice the way that you want it to be done.
Right. But when it goes to, buying office supplies, negotiating with insurance, you act as one large group.
Yes.
Okay.
Yes.
Okay.
Yes, we do.
And how long have you been with the group, and kind of give us, because we were talking, you didn't start that way.
That's right. So initially, when I finished my residency program, I knew that I didn't want to go into private practice solo. I just didn't feel like I was ready for it. I didn't feel like I had the business acumen to really kind of just start a business on my own and run it independently.
Mm-hmm.
So I joined a small group of 3 other doctors at the
Mm-hmm.
time, and it was the 4 of us. And
Which
it
is a
was great.
decent size. I mean, that's
Yeah,
that's
it
not so common.
Yeah, it was great. We operated well together as a group, but even with the 4 of us, we still would have, issues when it came to negotiating contracts, or when we're trying to say if we're hiring, say a new physician or something like that. There were we had to get assistance from the hospital. We had to get, assistance in different ways. So it created some drawbacks there. Um, for me, ultimately, I did leave that smaller group, not for those reasons. I just wanted to relocate to another part of the state, a little bit
Mm-hmm.
further south. Right now, I'm just about an hour north of Miami.
Okay.
So then I went to did like my worst nightmare when I first started out, and I started as a solo doctor, but was very, very
Well,
blessed and lucky.
the best laid plans, right?
Yeah, but it was great. It worked out fine as far as like my partners that I had before were amazing people. They taught me so much, so I felt like I had 2 feet on the ground at least when I got started. But the challenge that I found is that I still would have a problem when it came to trying to get paid for my work,
Mm-hmm.
or trying to recruit new staff for my practice. I would be competing with a hospital structure or a larger healthcare entity that could offer things like a 401k plan and this really good insurance or plan. And as a solo doctor with no partners, it's harder to offer those kind of options to those people. So I
Yeah.
would lose out a lot on recruiting, like say even another doctor or or ancillary staff. So my billing, trying to collect the fees and things like that, you hire individual billers or you outsource it out, was having some issues with that. And so just
Mm-hmm.
after a few hiccups, I wanted to start looking for other ways of practicing without having all the headaches.
Right.
um and so that's when my previous partners discussed about how, hey, we're thinking about joining this larger group. And at that time, they had maybe 40 plus doctors.
Mm-hmm.
He said the thing that's really good is that they have everything done. Like, all of like the hiring stuff, it's set, as far as we have these little protocols. So it's easy, if we want to hire X, then you just do this. Hey, if you want to do billing, this is our protocol for that. Hey, if you want to do
Mm-hmm.
this is your buy-in. So it made sense. They joined first, and then I kind of saw how they did within the group. I liked it, and then
Yeah.
I joined in 2016.
Yeah. It resembles like a franchise model, kind of, sort of. So there's this, centralized kind of, I'll say, back office or corporate office, whatever, and they
Yeah,
standardize and make things really efficient, like the things that are not clinical, buying all
yeah,
the stuff, hiring packages, all those
yes,
sorts of things, so that, and it's even in a large corporate world that's called shared services. So you've got,
yes,
6 divisions in a company, but you don't need 6 HR groups. You need one HR group that has little, representatives to each of the 6 businesses, because behind the scenes, even though, you're practicing in your care center and all the other 80s are practicing in their own, there's certain things that why should we have 80 versions of hiring somebody? Let's have one.
Yeah.
Let's have one purchasing account for paper clips and office supplies and whatever, and we'll buy reams of it and get a better price, and so on and so on. It makes a lot of but the difference is you've managed to keep the ownership all to yourself. I mean, to the
Yes.
partners.
Yeah.
And man, that's the sweet spot. Like that's how you can compete, because it comes down to buying power. I think in a lot of cases, we were talking about this before, is right. So when 80 doctors show up and say, yeah, we only want to pay a nickel for that box of paper clips, and then you show up as a single and guess I'm paying 30 cents, like there's nothing you can do about it. And it just adds up.
That's exactly right. That's
yeah.
Exactly right.
Yeah. And it's somebody else negotiating anyway, right? It's not even you necessarily. So your time is better.
Yes, that's what I'm saying. It takes a lot of like those day-to-day, like, headaches where, like, if you want, I wanted to spend more time practicing medicine and not just only, dealing with all of the little 100 different decisions that I had to make during the day because of this administrative thing here, this administrative thing there. Now we still make decisions. I mean, we're still like, involved, but it's just that there's a lot on like the management side that is managed for us that we don't have to worry about those headaches.
I'm curious, like, how do you get 80 partners to, when a decision's got to be made at the partner level, how do you get the 80 together? Or is there a vote? Like, how do you work through that?
Well, so typically the way that we have it organized is that, we do have our annual meetings where we're all trying to get together in person.
Okay.
But we do have an operating board where within each region, there's like, say, a representative. So say for like the Broward County region, we have a representative who speaks on the board on our behalf. For like, say, the Tampa region or the Panhandle region, they'll have someone who'll speak on their behalf. So it's not where we're having all 80 of us speaking at the same time. We'll have a representative from our region who discuss our thoughts.
Which is funny because it's an even number, and you never want that when you have to vote on anything, because then you have ties and oh my God.
Well, we'll say 80 plus. 80
okay,
plus.
Fair enough. Got to have an odd number.
Yeah.
So you mentioned something earlier. It's the largest single specialty practice, or one of the largest around. So there's single specialty and multi-specialty. Did you look at when you were thinking, look, I don't want to be a solo anymore, I want to get into this, this group concept? Did you look at both types? And how did you compare them? How would you compare them?
Yes, actually, at the time, I was looking between two different single specialty groups. It was like a northern based group and like a southern based group, which is like kind of based more so in Miami.
Okay.
So I wasn't looking at a multi-specialty group at that time, but I'm happy that I joined the group that I did, because the other group ultimately decided to join a multi-specialty group. I feel like the downside to being in a multi-specialty group is just that, you don't have as much power within the group. Say if there's only like, say, two of your specialty and then you have a specific need. Well, if there's like 100 doctors and there's like, 3 ENTs, and like, hey, well, we need this new, piece of equipment, and it doesn't really suit with like the 40 internal medicine doctors, needs, that it may get put on the back burner versus in a single practice, our specialty group, we have all the same needs and such. Plus, when what I found is that when they were bought out with a larger group, it makes a lot of sense when you're like maybe an older physician who is closer to retirement, because usually you'll get a certain amount of money like as a buy-in. Let's just say, or when you guys are negotiating, you may get like, say, $3 million or whatever. You make $1 million, they give you a certain amount, and then you get a certain percentage of what you bring in after that, and it may only be like, say, 30%. So if you're like going to practice for another 5 years and then retire, then you want to get your money, and then the little bit that you get afterwards, it doesn't matter.
Right.
But if you're a younger physician, like me, who's going to be practicing for like another 20, 30 years, then I probably wouldn't want to go into a multi-specialty where I'm buying in, getting selling my practice, in some form to them, get this big, payout up front, but then only get 30% for over like maybe 20 years. That may not work for me, because I think get upside down at some point in time.
Right.
The expenses.
Right. And the point you made about if you're a small voice in a large group, that has nothing to do with daily clinical life. That has everything to do with the realities of an organization. And so, yeah, if you're
Yeah.
out there and you're thinking about a multi-specialty, maybe one of the things you want to look at is how many others out there practice what I practice, and what kind of representation will we have in the overall group. If we are, only a couple percentage points, it's going to be tough for us to get what we need.
Hmm.
All the other benefits aside. So it's just something to weigh. It's just definitely something to weigh. Very
I think
interesting.
I think too, like for me, like one of the things I was thinking about was if I didn't join this group and I couldn't survive as a solo practitioner, then the other option would be that I would be a hospital, physician.
Yeah.
And I really didn't want to do that because I have a lot of friends who are hospital physicians. Nothing against hospitals. I mean, we need hospitals, but they didn't have, the independence. They didn't have like, a lot of the things that I was afforded in my own practice that I get by being a part of this private practice group.
Hmm.
They want to take time off, or they have to get that approved. If I want to shut down my office for a month, the other partners aren't going to say anything.
Hmm.
I get what I bring in.
Hmm.
But the hospital they'll start, coming on to you like, no, because you need to, bring in so much, money
Hmm.
for your practice every so often. And I just didn't like the thought of that, like just
Yeah.
not having that kind of power over my own life.
Yeah. And that was the next question I was going to ask you is, did you look at these other options? Buying power is one of the big benefits of a large group. There's other ways to get buying power. Um, but, in those cases, hospital or health system, you're no longer an owner. So that's the compromise that you make. And it's the big thing nationwide. There's some stories of people coming back out and reforming a private practice, but for most, it's selling and becoming an employee of somebody. You just never know what it's like to be an employee. You can ask other people all you want, but you just don't know it until you do it. And some like it and some don't. And you had the foresight. You said, I don't want to do that.
I think I know me. Like I guess I've always been built with that kind of like CEO like mindset, like that entrepreneur mindset where I just like having like
Yeah.
control over my own life and so forth. And I I'm not at the stage in my life where I want to be an employee.
Yeah. And if you feel that way, I don't think it ever changes.
Okay.
So I don't think it does. I was an employee for a long time, and I've never been happier being out. And I think I learned the same thing about myself is, boy, it's so much easier out here. My joke is I always agree with my boss. We finish each other's sentences. We're always in alignment. We always agree with each other. And it's just, joy, life's a lot easier. Life's a lot easier. Well, there could be so much more that we talk about this, but in the interest of, bite-sized advice on the business side of practice for our listeners, a couple of kind of finishing questions. The first one is there anything you think that our listeners need to know about what we've been talking about, but I just didn't ask you about?
Um, I think you did a good job of asking me, a lot about, just some of the benefits of being in private practice in a larger group versus, being a solo practitioner versus, joining a hospital or being a paid employee. I
Any
think
pitfalls of
that,
being in a group? Like watch outs, things, now that I'm in it, boy, it's not a killer, but I wish that, it's good to know this.
I think that nothing is perfect. Some of the things is like, maybe I want to do, well, let me think of a pitfall for being in the group. Obviously, there may be well, some of the things that we do, say if we want to do a certain procedure, for like, um, sinus surgery or something like that. We have these compliance protocols and paperwork that we do to try and make sure that everyone is in compliance, which is actually amazing. But it's just more paperwork and so forth that you're doing that you may not have done if you're on your own, if you're doing it on your own.
Okay.
So some of the pitfalls, it's just that you do have like that, that in that governance, you have your independence and we can have a lot of autonomy, but we don't have complete autonomy. If there's something that they say, hey, you know what, you have to do this protocol for this, procedure or whatever, then you have to kind of follow that protocol. Usually when we're doing things like that though, it's more so for safety. So that say if we're audited later, everyone's doing everything the same way, as far as like if you have to do say a procedure, we're showing, above the shadow, or beyond the shadow of a doubt that it's not being done unnecessarily. You
Hmm.
have like the CT scans and all the things to kind of back it up. So I mean, it's annoying, as a doctor sometimes to have to like do an extra couple sheets of paper, but I see the benefit of it.
Right. Would you have to do some kind of similar paperwork in a hospital or health system? Probably.
I,
I mean, it
you
sounds
probably
reasonable.
would. Probably would. And I think that
Yeah,
even if you typically, like, the paperwork that we have to do is just something that will be required by an insurance company either way. So that way you're kind of like already checking your boxes and dotting your I's and crossing your T's.
sure.
But
Okay. That's
so
not, yeah. I guess if you think that
it's
hard about a pitfall, it's not that much of a, it's not that bad. And it makes sense. If your back's against a wall, your private practice thinking, I gotta get bigger somehow. You're going to invite more administrative, weight anyway, I guess. So
yeah.
pick your poison. But with your way, you're
And I
still
think
private.
Yeah, exactly. And I think for me, it's also just a matter of like your mindset and like the way how you go into it. Like for me, my mindset is always a positive one, and I'm trying to think about ways of like if I see issues, usually I've brought it to the attention of whomever, and we try to address it. So the issues that I may have had in the past, I can't think of right now because we've
Sure.
we've addressed those issues. I mean, whenever you deal with a lot of heads of people thinking together, there's going to be some hiccups, and maybe you don't always agree with everyone in your group,
Sure.
but ultimately we're all just trying to practice medicine and treat people well and do good work and also
Yeah.
live our lives.
Keep a good thing going
Yeah.
because it's a good thing. Perfect. And then my other question is for those who are listening to this, whose interest has been picked about, I'm private and I want to stay private, and this is a way. Um, what are one or two tangible steps you could recommend that they take as soon as they're done listening to start to, explore the path of forming a group or joining a group, whatever it might be?
hmm Well, many times I would say just to kind of look at some of the doctors in your area. Like many times if you're a solo doctor, you probably talk to some of your colleagues to try and get cross coverage if you're going to, like, say, go out of town for the weekend or something like that. Well, if
Hmm.
you could build a relationship with them, maybe that's something you might want to consider as far as like, hey, maybe we could build this group where I'm doing my thing, you're doing your thing. We can have our own care pod, but our would you like to maybe work to our care center, but would you like to work together to try and come up with like a central
Hmm.
process for, HR and for all these things, and if they can get all that to kind of work.
Right.
So just, I guess, reaching out to your colleagues and see, just start having some conversations, and then
Yep.
you never know what could happen. This group started really small. I think it started with like maybe like 7 or 8 doctors, and now it's grown from there to like 80 plus.
In about how much time would you say?
I believe the group was founded in 1963, and it was like in like maybe 1998 or so that they started, and with like the 7 doctors.
That's
And
pretty
then
quick.
it's kind of grown within the past few years. So we were, like I said, it was 6 years ago, I was like, joining when there was like 40 plus doctors. And then what we ended up doing is merging with another larger group that had over 30 doctors, based on in West Florida, like in the Tampa, St. Pete region.
Hmm.
So when our two groups merged, that's how it kind of made that huge jump
Yeah.
uh,
Okay.
to
Yeah.
the thing.
Yeah.
And then we joined a couple of other groups based out of like, say, Panhandle, and a few from Miami. And so now we're kind of like covering like across the state of Florida with multiple different care centers.
Right, right. Yeah. So you're talking about leverage, right? So, Dr. X and Dr. Y who are in the same town and they're practice the same in the same corner of medicine. Why not? I could tell you from the marketing perspective, um, one practice with two offices doing the marketing is much less money than doing two separate practices with separate ownership, separate everything. It's less. And so there's a simple example of leverage. And now take that concept and multiply it along the other areas, that you have to get stuff for your practice. And
Mm-hmm.
it just gets better. Well, cool. Camysha, thank you. Thank you again. It's a hugely interesting conversation. I feel like we found, at least given more voice to a way to get big and stay private, and both are necessary, at least for our listeners. So I really appreciate you coming on and sharing your experience with it.
Thank you so much, Carl. This is great.
Yeah, we will put all of Camysha's info in the show notes for this episode. So if anybody wants to read up on her or maybe reach out and pick her brain a bit more, you'll be able to do that. And a couple of points before we finish. If you've had an experience with the business side of your practice like Camysha has, that you think others would benefit from, or if you're somebody like me that services private practice owners and you've got an experience that you think would help, we want you to come on Practice Care. So in the show notes for every episode, including this one, there's a link you can click, quick form to fill out. Tell us what's on your mind. Please do so that we can get you scheduled as soon as possible. And finally, if you haven't done so already, please subscribe to Practice Care on Apple Podcasts or wherever you listen to your podcasts. Thanks very much. And until next time.